In the USA during 2011, it was estimated that there were 450,000 burn injuries, of which 10% required hospitalization. Around 25,000 people had to attend specialist burn centers. This highly traumatized condition leads to expensive and sometimes prolonged periods of time spent in hospital. In Bangkok, Thailand, January 2012, 2 workers were injured in an industrial accident involving an exploding boiler. The doctor on duty explains their condition on arrival to the accident and emergency ward.
คนไข้ได้รับอุบัติเหตุได้รับแผลไฟไหม้เนี่ยค่อนข้างจะรุนแรงไหม้ประมาณ 50% ของ body surface area เนี่ยครับ
These burns patients were about to receive a new form of treatment. This wetling device uses a technology called WMCS by transferring energy to a wound using a non-invasive, painless microelectrical current as a catalyst. John Wetling, the inventor of this device, explains current of injury, the key principle behind wireless microcurrent stimulation technology.
The current of injury is based on what is called the skin battery. All over our body, we have an electric charge. If there is a cut in the skin, this skin battery does not exist in the wound any longer. But in the edge of the wound, there will be a so-called electric field. And this electric field is only going 2 to 3 millimeters into the wound bed. And that is where the current of injury is created. You will always see that a wound will heal from the edge. In our technology, we do exactly the same, but we transfer the charged particle down to the wound bed where the so-called current of injury will be established all over the wound in one session, which means that all the cells will be attracted up to the surface, and in a few minutes we will have a result. And this is absolutely pain-free, it's so easy to administrate, and it has an effect which is fantastic.
Daily treatments in conventional therapy are mainly related to protection of wounds. Frequent dressing changes are often painful and lead to enormous cost in ongoing nursing care. Dr. Munkon has treated over 15 patients over the past year using wetling devices. A striking difference that he sees is in pain relief.
We got a lot of cases. We just need to give them the narcotic and anti-pain medication for just a very short period, like just 1 day.
John Wetling explains the difference between his and conventional treatment.
The difference between this treatment and the conventional treatment when we are talking about burns is like day and night. Because in this treatment, we do not need to change the dressing. Changing dressing is the most painful situation for burns patient. In our situation, we keep the dressing on and we treat down through the dressing. And we do not change the dressing before it shall be removed. And when we remove it, we have healed skin.
After 5 days of treatment, both patients were showing good signs of recovery, were accepting visitors, were off pain medication, and their appetites had returned. This is the first time Dr. Suti has used this form of therapy. What are his main impressions of Wetling's WMCS technology?
เจ็บแผลน้อยนะครับคนไข้รู้สึกเจ็บน้อยกว่าปกติมากแล้วนอกจากนั้นการให้ยาหรือว่าการให้น้ำเกลือที่จะทดแทนในคนไข้นะครับก็ให้ใช้น้อยด้วยนะครับโดยรวมแล้วถือว่าได้ผลดีมากนะครับแผลแต่ละวันเนี่ยหายเร็วมาก
After 9 days of treatment, the younger patient is ready to be discharged. He is free from antibiotics, pain medication, and as we can see, 5 weeks after the day of the accident, most of the pigmentation has returned to his skin. Soon suffered 50% burns in the accident, and an area of great concern for those treating him was the upper area of his right arm, as that was very badly burned. Dr. Suti was pleased to note that the area had healed very well. In fact, the pigmentation had returned to most of the affected areas covering his body.
สำหรับในความเห็นของผมนะครับหลังจากที่ได้ลองใช้เครื่องนี้แล้วกับคนไข้ที่ได้รับบาดเจ็บไฟไหม้ขนาดรุนแรงนะครับก็คิดว่าเครื่องนี้น่าจะได้แนะนำให้หมอคนอื่น ได้ใช้เครื่องนี้ด้วย
For Dr. Munkon, it heralds a new era in treating burns patients.
As a doctor, I feel very impressed with the result of the technology. I feel lucky for the patient that there is a breakthrough technology like this to treat the burn and to make them feel much more comfortable during the treatment course.
So, to summarize, on day one, these two young men arrived in hospital. One had 40%, the other 50% second-degree burns and were in extreme pain. They received WMCS therapy using the Wetling device and had a single dressing applied after their first treatment. They were also receiving medication for pain relief. On the second day, the dressing remained. Both patients were in less pain and continued with the WMCS therapy. The use of medication for pain relief continued. By the third day, the medication for pain relief had ceased. The WMCS therapy continued until day 7, when the dressing was ready to be removed. On the 9th day of treatment, the younger patient was ready to be discharged. The elder patient required one more day of treatment and was discharged the following day. Wetling's technology has been approved in Europe and some parts of Asia. It is already treating people in Denmark, Sweden, Norway, Finland, Germany, Austria, Switzerland, Greece, Thailand, and Indonesia.